Welcome back, everyone, to Actual English. I'm Jennifer Clyde. It's time for lesson 95, and today's topic is a bit heavier than all the other topics. Well, we'll be talking about depression today. Of course, there is mild depression, which you shouldn't worry too much about, but sometimes, yes, people suffer from severe depression, where they even think about ending their lives, thinking about suicide. Now, of course, depression ranges in seriousness from mild to even temporary, like sadness, to even severe and, as I mentioned, persistent depression. But some clinical depression symptoms may include, I did some research, depressed mood most of the day or nearly every day, loss of interest or even loss of pleasure in a lot of activities, significant weight loss or even weight gain, sleeping too much, or not being able to sleep well every day. So, do you have any of these symptoms? Hopefully not, but there are a few more. Now, slowed thinking or even movement. And this becomes very obvious. People notice that you're thinking very slow and you're moving very slowly as well. Fatigue or low energy almost every day. What about loss of concentration? That is also a problem. So, if you see anybody with these symptoms, or if you are suffering from any of these or similar symptoms, you know what to do? You should always just ask for help. You could go to a professional or even ask a family member or a friend for help. All right? Okay, then let's begin by taking a look at today's actual talk.
Joanne, are you depressed?
Oh, it might be the weather.
Have you ever experienced depression?
Well, to be honest, I think I did experience borderline depression.
Like clinical depression, not like I'm having a bad day.
Yeah. I mean, I did go to the doctor once to find out if I did have depression. But I think it was just more to do with stress at school, just my brother being sick. Stuff like that. Weather has a lot to do with it as well. A lot of people around us are a little bit more gloomy now that it's a lot colder.
Okay.
Yeah, but I mean, have you ever been depressed?
No, we have our ups and downs, but I don't think I've ever come close to the clinical thing. Back in my day, people didn't go to doctors or take prescription medicines for depression. They just, talk to their mates, as you would call it. Or,
oh, yeah.
If somebody asked me, do I know a good therapist, I'd say, well, the bartender over there is pretty nice. Talk to him.
So you're not a huge fan of medication, therapists, and stuff like that?
In the last 20 years, I think we've seen, especially amongst our children, this shift from almost nobody taking drugs to almost everybody taking drugs.
Yeah, a high dependency on medications.
Everybody's on Prozac
instead of facing
how is the lithium treatment going?
I mean, I think the side effects of those medications are like headaches, vomiting. I mean, it's bad for your actual physical health.
Yeah.
I mean, it might help with the psychological aspects of things, but yeah.
Well, my cure for whenever I'm feeling a little down, my best cure is exercise.
Oh, to get some fresh air?
Get some fresh air, get some exercise, do something positive. And, rather than sitting around overeating or watching TV or something, just try to take a positive turn to everything, and you'll be good.
Welcome back, everyone. How did you enjoy today's actual talk between Peter and Joanne? Now, they did point out some great things, and you could mention a lot of what they talked about in a conversation if you happen to talk about depression sometime in the future. Now, Peter mentioned something about how people tend to have their ups and downs. Now, I'll be telling you exactly what that means, but it's true. We all have our good days and bad days, good times and bad times, of course. Sometimes we feel very depressed, sad about things, sometimes without a certain reason, we just feel down and gloomy, right? Well, we'll talk about that. Let's figure out what they mentioned in today's actual talk conversation. Okay, let's take a look. Peter says, Joanne, are you depressed? Are you depressed? So he's talking about how she is feeling perhaps at this moment. And Joanne says, oh, it might be the weather. So she's saying, well, if I look a bit depressed, if I seem to be a bit depressed to you, it's probably because of the weather. That's true. If it rains, people tend to feel a bit down, right? But on a sunshiny day, most people tend to feel very happy. So Peter says, have you ever experienced depression? Have you ever experienced something means, well, you're asking about a person's past experience. Have you ever experienced depression? Joanne says, well, to be honest, I think I did experience borderline depression. Now, borderline depression is, well, it's BPD actually. The term is borderline personality disorder. It is a severe case of depression. So that's when people, they don't have any energy to do anything. They don't feel like doing anything. They may lose their appetite, and sometimes it could get very severe, okay? So she's saying, well, I did experience borderline depression. And then Peter says, like clinical depression. Okay, we're seeing some difficult words here. First of all, we had borderline depression. As I did mention, it's also called BPD, okay? Now, borderline personality disorder, that is. What about clinical depression? Now, clinical depression is more of a term used a lot by doctors. Now, this is a very serious depression. So, instead of calling it major depression, for example, doctors may refer to major depression as clinical depression. Just keep it in mind. These two are pretty serious, severe depression, okay? And then Joanne says, yeah, I went to the doctor, meaning I went to the hospital once. Why? To find out if I had depression. But I think it had more to do with something. In this case, stress. I think it had more to do with stress at school and my brother being sick. Let's take a look at the sentence. So what does it mean? Have to do with or have to do more with. We're talking about things related to each other. So she's saying, I think it had more to do with stress, meaning I think it was more related to stress. I think it was more associated with stress, okay? So when you want to talk about perhaps the cause of something, you can say, I think it has to do with something, meaning I think it is related to something. Simpler, I think it is because of something, all right? She says, the weather has a lot to do with it, okay? Have to do with, once again, it is related. The weather, of course, somehow, if it's a rainy day, as I mentioned, you feel down. If it's sunny, you feel happy. So it has a lot to do with something. A lot of people around us are a little gloomier now that it's a lot colder. Now, if you listen very carefully to actual talk, I believe Joanne said more gloomy, okay? I made that correction for you. More gloomy would be incorrect, although a lot of people do say more gloomy in conversation, but the correct form would be to say gloomier, okay? Not more gloomy, it's gloomier. So, a lot of people around us are a little gloomier, meaning what? Kind of depressed, feeling down. And then she asks, have you ever been depressed? Okay, let's find out what Peter said. Well, he simply said no. No. We have our ups and downs. Okay, we have our ups and downs. So, I'll tell you what that means. Do you know what it means? Ups and downs. To have one's ups and downs. Now, when you're happy, we say we feel up, right? Now, when we're sad, you feel down. So, when you talk about people having their ups and downs, you're talking about people experiencing good times and bad times, okay? So he's saying, you know, people in general, we have our good times and bad times. We have our ups and downs. But I don't think I've ever come close to the clinical thing. He's talking about clinical depression. And then he says, you know, back in my day, we went over back in the day, right? Back in the day, you would mention that when you want to talk about a time when you were younger. those good old times, for example. Okay, when you reminisce of the past. Back in my day, Peter says, he's talking about a time when he was younger. He says people didn't go to doctors or take prescription medicines for depression. Okay, we often take medicine. We take medication. In this case, we're talking about prescription medication, medicine, or even drugs. Okay, usually you need a form, you need a prescription from the doctor. You need the doctor to prescribe you something in order to get it. Okay, those are prescription drugs as opposed to over-the-counter drugs. So take medication for something. We'll take a look at that pattern later on. And then he says, they just talked to their mates. This is one of our vocab words for today. I believe compared to Americans, I think more, European people tend to say mate. Sometimes they even say might, but it's mate, meaning friend or a coworker, a colleague, an associate, okay, someone that you know. So he's saying, when I was young, people didn't go to the doctors or even take medication or medicine for depression. They didn't take drugs. They just talked to their friends. That is what he is saying. He says, if somebody asked me, do you know a good therapist? You could go to a therapist to get help, a professional. He's saying, if somebody asked me this question, I would say, well, the bartender over there is pretty nice. Talk to him. So he's kind of joking, meaning for him, he doesn't really get depressed and he doesn't feel the need to go see a therapist, okay? He could just talk to somebody comfortably, talk about his problems, and he will feel better. So if somebody asked him this question, he would probably advise them to talk to someone and let everything out. So Joanne says, so you're not a huge fan of medication, therapists and stuff like that. Now, be a huge fan of something, meaning to like very much, to love very much, okay? He says, oh no, in the last 20 years, I think we've seen, especially amongst our children, the shift from almost nobody taking drugs to almost everybody taking drugs. Now, shift here, we're talking about a change, okay? So he's saying, these days, in the past or last 20 years, I've seen a lot of changes happening. And I see these days, especially younger people, they tend to take a lot of medication. Whereas before, 20 years ago, people didn't really take medication for things. That's what he's saying. Drugs does not necessarily mean the bad drugs all the time. Drug or drugs could also mean medicine, okay? We can take drugs for a cold or even a headache, so keep that in mind. Now, Joanne says, yeah, a high dependency on medications instead of facing their problems. Now, if you face something, it means that you are accepting the facts, accepting something instead of running away from it, okay? And high dependency on something is really relying on something. Moving on now, Peter says, yeah, everybody's on Prozac. This is just a name of a medication. I believe it's a prescription medication. Yes, that's prescribed to patients with depression. Anyhow, he says, how is the lithium treatment going? Lithium treatment, I believe it's used a lot for patients that are actually suffering depression. It kind of helps them feel at ease, okay? Now, Joanne says, I think the side effects of those medications, she's talking about side effects, 부작용, right? Some side effects are headaches, even vomiting. It's bad for your actual physical health, she says. Well, whenever I'm feeling a little down, my best cure is exercise. Now, as you see, we see a star there. That means it's going to be our pattern for today. We'll practice that later on. Anyhow, Peter says, whenever I'm feeling a little down, meaning depressed, my best cure is exercise. It means when I feel down, when I feel depressed, I exercise. Exercising makes me feel better, okay? And then moving on, Joanne says, get some fresh air, get some exercise, Peter continues by saying, get some fresh air, get some exercise, do something positive rather than sitting around overeating or watching TV. So he's focusing on the positive things. Do something, be active. Don't just sit there at home by yourself watching TV or just overeating, eating and eating and eating. Try to take a positive turn to everything and you'll be good. Take a positive turn, okay? It basically means when you feel a bit down, depressed, you could take a positive turn. You're going the left way, feeling depressed, even more depressed. You take a positive turn, so you're switching lanes, for example. You're taking a different path, a different lane, which is the opposite of feeling depressed. This may sound a bit difficult, everyone, but have a listen to it one more time and test yourself. See how much more you can understand. Here's the actual talk conversation one more time.
Joanne, are you depressed?
Oh, it might be the weather.
Have you ever experienced depression?
Well, to be honest, I think I did experience borderline depression.
Like clinical depression, not like I'm having a bad day.
Yeah. I mean, I did go to the doctor once to find out if I did have depression. But I think it was just more to do with stress at school, just my brother being sick, stuff like that. Weather has a lot to do with it as well. A lot of people around us are a little bit more gloomy now that it's a lot colder.
Okay.
Yeah, but I mean, have you ever been depressed?
No, we have our ups and downs, but I don't think I've ever come close to the clinical thing. Back in my day, people didn't go to doctors or take prescription medicines for depression. They just, talk to their mates, as you would call it. Or,
oh, yeah.
If somebody asked me, do I know a good therapist, I'd say, well, the bartender over there is pretty nice. Talk to him.
So you're not a huge fan of medication, therapists,
no,
stuff like that?
In the last 20 years, I think we've seen, especially amongst our children, this shift from almost nobody taking drugs to almost everybody taking drugs.
Yeah, a high dependency on medications.
Everybody's on Prozac
instead of facing
how is the lithium treatment going?
I mean, I think the side effects of those medications are like headaches, vomiting. I mean, it's bad for your actual physical health.
Yeah.
I mean, it might help with the psychological aspects of things, but yeah.
Well, my cure for whenever I'm feeling a little down, my best cure is exercise.
Oh, to get some fresh air?
Get some fresh air, get some exercise, do something positive. And, rather than sitting around overeating or watching TV or something, just try to take a positive turn to everything and you'll be good.
Are you ready for today's actual expressions? Let's begin with some vocab words just to help you refresh your memory. Think of this as a review of what we learned so far in the actual talk conversation. So Peter mentioned something about how you and we all have our ups and downs. Remember what it means? The good times and the bad times. So that's right, the synonym would be good and bad times, our ups and downs. And the next word is mate. Of course, animals can mate as a verb to reproduce and have babies, of course. Bears could have cubs, for example, if they mate. But we are talking about a noun, mate. In this case, we're talking about a friend. Peter mentioned something about how, when he was younger, people would usually talk to their mates, right? Meaning talk to their friend, coworker, or even a spouse, the person you are married to. What about shift? I mentioned it means to change or even exchange in some cases. And high dependency. Dependency itself, let's take a look. Dependency, stress goes right there. It's kind of an addiction or relying on something, okay? A high dependence on something means that you probably cannot survive without it. So you need special care, more than usual, okay? All right, let's move on to some patterns. Now, take prescription medicines or medication for something. Prescription could be included or taken out as well. If you want to talk about a simple, painkillers or even a cold medicine, you do not need a prescription for it, so you wouldn't call it a prescription medication or drug, right? Here are a few samples. My father takes prescription medication for high blood pressure. Always when you want to talk about medication, always remember to use it with to take. Take 2 pills. Okay, take a pill every 4 hours. Take cough medicine every 5 hours, for example. I take medication for something. My father takes prescription medication for high blood pressure. What about this one? Should you take medication for anxiety? Once again, take medication. So, you may ask this question, should people in general, should you take medication for anxiety? Some people say yes, some people say no. I would probably say no. Why take medication when you've got help out there, right? Okay, so keep that pattern in mind. And our next pattern is to face something. We're not talking about our face, okay? To face something means to actually go against something, accept the facts, accept the truth, don't run away, okay? So face something. For example, you could say, I'm facing the biggest challenge of my career. I'm facing the biggest challenge of my career. So in this case, you are saying that, well, it's a fact. You're having a hard time, but you are not running away from it. You're trying your best to do what you can. I'm facing the biggest challenge of my career. Perhaps it can also mean that you are experiencing a very difficult time. What about this one? Many college graduates face difficulty finding jobs. That's right. So now you are saying that many college graduates are experiencing difficulty in finding jobs. Okay, to face something once again means not to run away, but to actually do something about it. Go against it, okay? Here we've got one more pattern. Peter also mentioned, whenever I'm feeling a little down, meaning depressed, my best cure is exercise, meaning exercising makes me feel much better. It makes me feel happier whenever I'm feeling a little down. Let's try a few sample sentences. Whenever I'm feeling a little down, my best cure is sleeping. Okay? So think about what you do. What do you do when you feel depressed? Do you go for a drive? Do you listen to music? Do you talk to your friends? Do you go out for a drink? Just add that. Whenever I'm feeling a little down or depressed, my best cure is... That's right. My best cure is actually sleeping. Let's check out one more. Whenever I'm feeling a little down, my best cure is... Let's check it out. Having some alone time. We talked about this a long time ago. Alone time is time to yourself. Time spent by yourself, on your own. You can also say, my best cure is getting some time to myself. These two actually mean the exact same thing. Now, time spent alone. I don't like to be bothered by people. When I'm feeling a little down, my best cure is just spending time by myself. You can try using these patterns, okay? Okay, job well done. That's a wrap.
So depression is something that is very personal to me. When I was in middle school and high school, I suffered a lot from just very severe depression. I hated who I was. I hated the way I looked. I hated everything about me. And there was no joy in my life. And so when I hear people about talking about being depressed, like my heart really goes out to them. And I think the way that I was able to overcome it was to truly realize that I am someone who has worth, that I am significant, that I have a purpose in this life. And I think a key way to being out of depression is surrounding yourself with people who love you, who really accept you for who you are and speak life over you, who will tell you that you're worth it, that you're good enough, and you're really worth getting to know. So I think that was my own experience, that once I was in a community of people and of friends that just told me how much they love me and how much good I had in me, I realized, oh, I am worthy and I am good, and there's nothing to be depressed about, that I don't have to put my identity in the world, but that I'm good enough the way I am. So that's how I overcame depression, and I really hope that, yeah, I will see kids in this nation also overcome depression as well.
Welcome back, everyone, and thanks to Michelle for sharing a wonderful story. Sounds like she did go through a difficult phase when she was a lot younger, but great to see that you are doing just fine right now. Okay, so let's take a look at what she mentioned in today's actual story. She says, when I was in middle and high school, I suffered from. We went over this. To suffer from something means to experience difficulty, even an illness. But she suffered from serious depression. Serious depression, that is. Not mild depression, but serious depression. She says, when I hear people talking about being depressed, my heart goes out to them. My heart goes out to you. My heart goes out to her. My heart goes out to them. My heart goes out to whoever. You're saying that you really, really have a strong feeling for their feelings as well. You can feel their pain, okay? So in that case, you can say, my heart goes out to them or you, and so forth and so on, okay? Moving on to our last sentence. I think the key to getting out of depression is to surround yourself with people who love you and accept you for who you are. 있는 그대로, right? So it is important to be around friends and family that love you no matter what and that accept you for who you are. People that don't try to change you are the ones that truly, truly love you and care for you, I believe. Okay, that is a wrap for today's actual story. Job well done.
So depression is something that is very personal to me. When I was in middle school and high school, I suffered a lot from just very severe depression. I hated who I was. I hated the way I looked. I hated everything about me. And yeah, there was no joy in my life. And so when I hear people about talking about being depressed, like my heart really goes out to them. And I think the way that I was able to overcome it was to truly realize that I am someone who has worth, that I am significant, that I have a purpose in this life. And I think a key way to being out of depression is surrounding yourself with people who love you, who really accept you for who you are and speak life over you, who will tell you that you're worth it, that you're good enough, and you're really worth getting to know. So I think that was my own experience, that once I was in a community of people and of friends that just told me how much they love me and how much good I had in me, I realized, oh, I am worthy and I am good, and there's nothing to be depressed about, that I don't have to put my identity in the world, but that I'm good enough the way I am. So that's how I overcame depression, and I really hope that, yeah, I will see kids in this nation also overcome depression as well.
Okay, well, today's topic was depression, but don't be all sad about today's topic. It was a rather heavy topic, but look on the bright side, as I mentioned. Think about the good old things, the people that surround you that really, really love you. Think about family, everyone that supports you all the way. No matter what and no matter who you are, they will accept you for who you are and love you for who you are. Okay, well, next time we'll talk about another topic. We'll talk about telepathy and deja vu. Now, these two words are pronounced quite differently from the way it's pronounced in the Korean way. Telepathy, it's telepathy. We'll talk about that. In the meantime, come to our homepage, find your way over to www.ebse.co.kr and look for Actual English with Jennifer. Come by to say hello. I'd love to hear from you. Okay, that's it for today. I'll catch you again next time. Bye for now, everyone.